Great. So I've got the first question for the panelists, and it's with relation to a report that I read recently that was published in the UK by Plextech. And they talk about that the connected home in 4 years' time in England will replace some healthcare services, right? That is a really big, strong vision. Just in, you put up 2027, they're talking about 4 years' time, this will happen in England. Now, I'm thinking from the perspective of each of your vantage points and your specialists, your expertise. Think of all the moving parts involved in making a connected home. Think about the fact that, even if you're capturing through voice, somebody's saying in my own words, these are my side effects, right, in relation to a drug I'm supposed to take. In terms of how seamless the design, for example, the back end, how those different organizations work together to provide that seamless experience. I mean, it's just staggering for me to think how that actually works, in terms of those moving parts. So my question is, if this is this bold vision for the future, just 4 years away, how do you see, different aspects of the market being supported with this home becoming a health device?
I'll be happy to take that one. So at the last South by Southwest, I hosted a panel called Home Sweet Home, the Health Hub of the Future. And I had on the panel Dr. David Brew, who's from Samsung, Chief Medical Officer. I had a geriatrician, and I had an architect. And I believe that's where we're going to head. We will have this built into the home, and it will become part of it as we get architects and interior designers into understanding that they can actually affect these different experiences for people. And then you have the bathroom is where we do our health. It's where we do first aid. It's where we can measure things. And many of the companies that own the bathroom are taking it seriously and looking at what it means to connect their devices to provide that better experience.
Will our homes need to be regulated by the FDA because health information everywhere?
So it's not about collecting the information, right? So from FDA's perspective, I think I see the vision where, I'm completely agreeing with my colleague over here that it's going to be so ubiquitous at a time where you'll not even realize that you're collecting the information. And when you start doing the next level of analysis on top of it, I think that's where it becomes more important. It's not about collecting how many steps you walk or how many cups of water you drank. It's all feeding into something that's going to tell you what's going to happen to you. And I think the promise in my mind, and maybe it's not 5 years away, but I'm hoping it's near, is we will be able to detect things so early that our interventions will be so small that will drive ultimately how we look at healthcare in general. So keeping that in perspective, so that's how I think about regulations and thinking about the next level up where it becomes sort of the next level analytics that we can think about and care about and to be accurate. Right?
Yeah, I think that's right. I think as the trend continues towards what's been called zero UI, which is essentially there's no user interface. Essentially, there's no app that you don't have to touch. It's just sort of seamlessly, the sensors get smaller. You step on your scale, and magically it goes somewhere. You have no idea where, but it goes somewhere. And I think that's a good trend. I think this technology needs to be sort of seamless for it to really get wide adoption outside of these smaller type studies. I look at digital health, in general as kind of a method of triage of patients, and I think that we'd like to have doctors at patients' homes all the time, but that would be very expensive to do. But there are certain services that can be delivered, maybe lower risk services that can be delivered in the home that can maybe prevent somebody from having to come to the hospital. So I think those are the opportunities we need to kind of sort of look at is how can we make these things seamless, and how can we prevent, how can we triage healthcare leveraging technology. We have to think of technology, as mentioned before, and I agree wholeheartedly, is a tool in the belt of the healthcare professionals. And it's one of many tools. It's not the panacea, every be all end all. It's one of many tools, including diet and nutrition and drugs and traditional devices and the traditional healthcare system, but it just supplements it and makes it more efficient and hopefully better.
Yeah, I think 4 years is a very short time frame, but I do think in the big picture, what will be very interesting is when we really see, a blur between early detection and prevention, because at the end of the day, it's actually very much the same thing. Right now, we all have genetic mutations, we're all cancer carriers, but our immune systems and our bodies fight those processes, so they're never clinically relevant. So, as the home becomes connected, and say you have a toilet that can tell you you have X, Y, or Z, those now are early detection systems which actually become preventative measures. But I think what it really comes down to when something goes from detection to prevention, and even with a connected home and potentially connected scales, or how then do you create the behavior modifications to really have an impact in a patient's life? Because that mirror can tell me, hey, you're 5 pounds fatter, you ate that piece of cake, and here's what you're going to look like in a year. But actually modifying people's behavior is really challenging. So whether we know you have 1 cell of cancer or 10 cells of cancer, you eat a piece of chocolate cake and now you're going to have heart disease, it really comes down to behavior modification, and I think that's where we're in dire need of true innovation.
To that point, we're now in this exponential age of lots of options for wearables and apps, from a connected home to a connected phone, and clinicians don't want to be overwhelmed with data, an individual doesn't. And back to this behavior change point, a lot of the apps and services that are out there are sort of still one-size-fits-all user interfaces. Maybe with the mindset of a Bay Area person who's wearing a Google Glass and has an iWatch. How do we blend both the regulatory pieces, the design, all these elements, so that when I'm trying to do behavior change, it knows that I'm an ENTP on the Myers-Briggs, or the characteristics. When you look in the mirror in the morning, your digital mirror is going to be showing you future you when you're tending to keep having that donut for breakfast. So I think there's an interesting opportunity there, but it blends all the challenges here to bring to what the consumer needs to tune it. Precision medicine moves to precision digital health intervention.